Millions of seniors across the United States are living with the daily reality of managing their blood sugar. Whether it's due to prediabetes, insulin resistance, or full-blown type 2 diabetes, this condition is deeply emotional, frustrating, and often overwhelming. People from Canada, the United Kingdom, and Australia are also facing the same struggle, but it's especially widespread and urgent in the United States, where the American diet, high stress, and sedentary lifestyle have all contributed to this silent epidemic. Every day, older adults wonder why they feel so tired, why their vision blurs after meals, why they get shaky if they miss breakfast. The answer, often hiding in plain sight, is blood sugar instability, and it can quietly destroy quality of life if left unaddressed. But here's the truth. There are natural ways to support blood sugar balance. Certain supplements, when used correctly and consistently, can make a massive difference. The first thing to understand is that aging naturally makes blood sugar harder to control. As we grow older, our muscle mass declines, our mitochondria slow down, and our body becomes less responsive to insulin, the hormone responsible for moving glucose from the bloodstream into cells. This isn't just a random fact. It's a daily battle for millions of seniors in the United States. An 82-year-old woman in Ohio might notice her blood sugar spikes after a sandwich, even if she eats the exact same food she had at 40. Why? Because her pancreas is under stress and her cells just aren't responding to insulin like they used to. Supplements can help, but only if we know which ones actually work and how they work inside the body. Many seniors are wasting money on cheap capsules that do nothing. We have to talk about the ones backed by research, not hype. Berberine is one of the most powerful natural compounds for blood sugar control, and it's gaining attention fast in the United States for a good reason. Berberine works similarly to metformin, a prescription drug often given to people with type 2 diabetes. It activates an enzyme called AMPK, which helps improve insulin sensitivity, reduce glucose production in the liver, and enhance glucose uptake in the cells. This is not just theory. Real studies show it works. In one study, adults who took 500 milliliters of berberine 3 times daily for 3 months saw significant reductions in fasting blood glucose, post-meal blood sugar, and even A1C levels. Many older adults report clearer thinking, more stable energy, and even weight loss after adding berberine to their daily routine. But berberine must be taken consistently and with food to avoid gastrointestinal upset. It's also important to buy it from a reputable US-based supplement company, because low-quality versions flood the market and may contain harmful fillers or not enough active ingredient. Magnesium is another supplement that can't be overlooked. Most people in the United States, especially seniors, are deficient in magnesium, and this has a direct link to insulin resistance. Magnesium plays a critical role in glucose metabolism by supporting insulin signaling. Without enough magnesium, insulin becomes less effective, and blood sugar remains elevated. Seniors with type 2 diabetes often have low magnesium levels, but they don't know it because it's not checked on routine blood work. In Canada, studies showed that magnesium supplementation improved fasting glucose and insulin sensitivity, especially in those who had low levels to begin with. The type of magnesium matters too. Magnesium glycinate and magnesium citrate are more bioavailable forms that are gentler on the digestive system compared to magnesium oxide, which is often sold in cheap US supplements and can cause diarrhea. Cinnamon extract, particularly the type known as Ceylon cinnamon, is another strong contender. Many seniors have heard of using cinnamon to lower blood sugar, but they don't realize that not all cinnamon is the same. Cassia cinnamon, the one found in most grocery stores in the United States, contains a compound called coumarin, which can damage the liver in high doses. Ceylon cinnamon, on the other hand, has minimal coumarin and is safer for long-term use. Clinical trials have shown that cinnamon extract can lower fasting glucose and improve insulin sensitivity, particularly in individuals over the age of 60. In one US-based study, participants taking 500 milliliters of cinnamon extract daily experienced a significant reduction in blood sugar within 40 days. But to truly see benefits, it must be the extract form, not just sprinkling a little on oatmeal. And dosage matters. Most trials use between 500 milliliters and 2,000 milliliters per day. Alpha-lipoic acid is a compound made in small amounts by the body. But as we age, our levels decline, and that matters. This antioxidant helps improve insulin sensitivity and supports nerve health, which is crucial for seniors who have diabetic neuropathy. People in the United Kingdom who took alpha-lipoic acid for 12 weeks showed improvements in glucose uptake and reported reduced tingling and numbness in their extremities. In the United States, many seniors are suffering in silence from burning feet or stabbing leg pain at night, not realizing that poor blood sugar control and nerve inflammation are to blame. Alpha-lipoic acid reduces oxidative stress in the nerves and improves blood flow, which can relieve some of that pain. However, it has to be taken consistently, and most studies use a dose of 600 milliliters to 1,200 milliliters per day. It's available over the counter in the US, but always check that it says R-alpha-lipoic acid for maximum bioavailability. Chromium picolinate is another supplement often recommended for blood sugar, but there's confusion around it. Chromium helps insulin work better by enhancing its action at the cellular level, and it may help reduce cravings, especially for sweets and carbohydrates. In a Canadian study, older adults with type 2 diabetes who took chromium picolinate saw a significant decrease in fasting blood glucose and better post-meal glucose control. Yet, not everyone responds the same. Some seniors notice immediate benefits, while others need several weeks to see changes. It's also important not to exceed recommended doses, usually around 200 mg to 1,000 mg daily, because excessive chromium can harm kidney function, a concern especially relevant for seniors whose kidney function is already compromised due to age or diabetes. Fenugreek is a lesser-known herb but extremely effective for stabilizing blood sugar in seniors. Fenugreek seeds contain soluble fiber, which helps slow carbohydrate absorption and increase insulin sensitivity. In Australia, researchers observed that fenugreek seed powder added to the diets of type 2 diabetic patients significantly improved both fasting and postprandial blood glucose. Many seniors also report a reduction in appetite and cravings when using fenugreek, which can indirectly support weight loss, an important part of managing blood sugar naturally. It's often available in capsule form or as seed powder to mix with food, but the bitter taste makes capsules a better option for most. Dosages used in research range from 5 grams to 15 grams per day. Bitter melon, another natural remedy, mimics insulin and helps move glucose into the cells more effectively. This fruit, used in traditional medicine across Asia, is now becoming more popular in the United States for its blood sugar-lowering effects. In several trials, bitter melon extract lowered fasting blood sugar levels significantly, especially in individuals with insulin resistance. Seniors in the US who prefer natural options over prescriptions often find bitter melon appealing, but it can cause gastrointestinal issues if not started at a low dose. It's crucial to monitor blood sugar closely when using bitter melon because its effects can be strong, especially when taken alongside other medications. Gymnema sylvester is another powerful herb that supports healthy blood sugar by reducing sugar absorption in the intestines and increasing insulin production in the pancreas. Often called the sugar destroyer, Gymnema can even dull the taste of sweetness when placed directly on the tongue, helping to reduce cravings. U.S. studies have confirmed its effectiveness in lowering A1C levels over 3 to 6 months, especially in older adults. Seniors who feel like they are constantly battling sugar addiction often find Gymnema a game changer because it helps reduce the emotional highs and lows of sugar binges and crashes. But like other supplements, it must be part of a consistent routine, not used sporadically. Turmeric, particularly in the form of curcumin extract, also deserves serious attention. Chronic inflammation plays a massive role in insulin resistance and type 2 diabetes, and turmeric is one of the most powerful anti-inflammatory substances available. In one United States-based clinical trial, older adults with prediabetes who took curcumin for 9 months had a much lower risk of progressing to diabetes compared to those taking placebo. Curcumin helps reduce inflammatory markers like CRP, supports liver function, and improves the body's ability to use glucose. However, turmeric from cooking is not enough. Seniors should look for high-potency curcumin extracts combined with piperine from black pepper to improve absorption by up to 2,000%. Dosage ranges from 500 milliliters to 2,000 milliliters daily, depending on severity of symptoms and underlying inflammation. Another supplement gaining attention in the United States for blood sugar control among seniors is inositol, particularly myo-inositol and D-chiro-inositol. These compounds act like insulin sensitizers and improve the way cells respond to insulin. In older adults, especially postmenopausal women who often struggle with hormonal imbalances and rising blood sugar, inositol can play a crucial role. Clinical studies in the United Kingdom have shown that inositol supplementation significantly reduced fasting glucose, improved insulin sensitivity, and even aided in lowering triglycerides. Seniors who experience metabolic syndrome, a cluster of conditions including high blood sugar, belly fat, and high blood pressure, may find inositol especially effective. It's important to note that for blood sugar, the best ratio is 40.1 of myo-inositol to D-chiro-inositol. This mimics the body's natural balance and ensures better results. It's usually well tolerated, but must be taken for several weeks to months for full effects. Vitamin D3 is also deeply connected to blood sugar health, especially among seniors living in northern states like Minnesota, Michigan, or New York, where sunlight is limited for half the year. In the United States, it's estimated that over 70% of older adults are deficient in vitamin D. This deficiency isn't just about bone health, it directly affects how the body handles insulin. Vitamin D receptors are present on insulin-producing beta cells in the pancreas. Without enough vitamin D, insulin secretion becomes impaired, and glucose control deteriorates. Studies in Canada have linked low vitamin D levels to increased insulin resistance and higher A1C values. Supplementing with 2,000 to 5,000 IU of vitamin D3 daily, especially during the winter months, can make a real difference. But testing is crucial. Most seniors have no idea they're deficient, and standard blood panels don't always include vitamin D unless it's specifically requested. Zinc is another essential mineral that becomes increasingly important with age. Zinc supports over 300 enzymatic reactions in the body, many of which involve carbohydrate metabolism and insulin function. Seniors with diabetes or prediabetes often have lower zinc levels due to chronic inflammation and oxidative stress. Zinc deficiency is especially common in the United States among older adults who have poor diets or take medications that deplete zinc, such as certain diuretics or ACE inhibitors. Research shows that zinc supplementation can reduce fasting glucose, improve insulin sensitivity, and even help with wound healing, a critical concern for seniors with diabetic ulcers. A dose of 30 to 50 milliliters of elemental zinc daily, often in the form of zinc picolinate or zinc citrate, is typically used in studies. But too much zinc can interfere with copper absorption. so it's important to monitor balance over time. Coenzyme Q10, or CoQ10, is another supplement that should be on the radar for any senior trying to stabilize blood sugar. As we age, CoQ10 levels drop naturally, and this can impair mitochondrial function, the very process that converts glucose into usable energy. Seniors with fatigue, brain fog, or sluggish recovery from physical activity might actually be experiencing the downstream effects of poor glucose utilization. In the United Kingdom and Canada, studies have shown that CoQ10 improves insulin sensitivity and reduces oxidative stress in diabetic patients. It's also vital for heart health, another area of concern in diabetic seniors. A dose between 100 to 300 millimolars daily, preferably in the form of ubiquinol for better absorption, is most effective. Seniors on statins are at even higher risk for CoQ10 deficiency, since these medications deplete it from the body, worsening energy and blood sugar control. Omega-3 fatty acids from fish oil have shown incredible benefits for improving insulin sensitivity and lowering triglyceride levels in older adults. In the United States, where the average senior's diet is high in omega-6 fats from processed food and low in omega-3s, this imbalance leads to chronic inflammation and insulin resistance. Multiple studies conducted across the United States and Australia have confirmed that omega-3 supplementation can reduce fasting blood glucose, lower A1C, and decrease inflammation. But not all fish oil is created equal. Seniors should look for purified, high-concentration EPA and DHA supplements that are tested for heavy metals. Dosages used in clinical trials range from 1,000 to 3,000 ml of combined EPA-DHA per day. Taking them with meals enhances absorption and reduces any chance of fishy aftertaste or gastrointestinal discomfort. Resveratrol, a compound found in the skin of red grapes, has shown promising effects in helping older adults regulate blood sugar levels and improve overall metabolic health. Resveratrol activates the SIRT1 gene, which is involved in insulin sensitivity and energy metabolism. In US-based studies, seniors who took resveratrol saw improvements in postprandial glucose and inflammatory markers, especially those with type 2 diabetes. It mimics some of the effects of calorie restriction, which has been shown to improve longevity and metabolic health. But the typical resveratrol content in wine is too low to have any real impact, so supplementation is necessary. Effective dosages range from 100 milliliters to 500 milliliters daily, preferably in a micronized form for better bioavailability. Resveratrol also supports cardiovascular health, which is critically important for seniors with diabetes who face high risk of heart attack and stroke. Fiber supplements, particularly soluble fiber like psyllium husk or glucomannan, are essential for seniors struggling to manage post-meal blood sugar spikes. In both the United States and Canada, where processed and fiber-poor diets are common, many seniors fail to get even half of the recommended daily fiber intake. Soluble fiber slows gastric emptying and carbohydrate absorption, leading to smoother blood sugar responses after eating. In clinical trials, taking fiber supplements before meals led to significantly lower postprandial glucose levels and even weight loss in older adults. Psyllium, taken with a large glass of water 15 to 30 minutes before meals, creates a gel in the stomach that reduces sugar absorption. Glucomannan, derived from the konjac root, has also been shown to support healthy A1C levels and improve cholesterol profiles. However, fiber supplements must be introduced gradually to avoid bloating or cramping. L-carnitine, an amino acid derivative, plays a key role in mitochondrial function and fat metabolism. Older adults, especially those in the United States dealing with metabolic syndrome, often have sluggish fat oxidation, leading to increased fat storage and insulin resistance. Acetyl L-carnitine, a highly bioavailable form, has shown in studies to enhance glucose utilization in muscle cells and reduce insulin resistance. In Australia, trials showed improved energy levels and reduced waist circumference among diabetic seniors using carnitine daily. The standard dosage ranges from 500 ml to 2,000 ml per day, often divided into 2 doses. It's particularly effective when combined with a mild exercise routine, which amplifies its ability to shuttle fatty acids into the mitochondria for energy production. Ginseng, particularly American ginseng, Panax quinquefolius, is another herb with powerful blood sugar lowering properties. In the United States, American ginseng has been used traditionally for vitality and immune health, but its benefits for glucose control are now being recognized. Studies show that taking 1 to 3 grams of American ginseng before meals can blunt blood sugar spikes and improve insulin response in older adults. Seniors often describe feeling more balanced and less fatigued after meals when using ginseng consistently. It's essential, however, to buy high-quality root powder or standardized extract, as many cheap supplements sold in the U.S. contain fillers or are underdosed. Taurine, a sulfur-containing amino acid, may not be as well known as others, but it's incredibly important for metabolic health. As we age, taurine levels drop, and this affects insulin sensitivity and glucose metabolism. In Canadian research, taurine supplementation was found to reduce fasting glucose and improve lipid profiles. It also supports cardiovascular function, which is critical in managing diabetes-related complications. Taurine doses typically range from 1,000 mg to 3,000 mg daily and are best taken with meals for maximum absorption.